Absolutely. So when I think about underlying factors, I think really heavily about structural oppression, forms of structural oppression, their policies, their practices that undergird systems and institutions in our nation that are really fundamentally rooted in elevating the needs of some, a very narrow cross-section of the population, and really creating such harm to so many others. And more what we've seen in the last 2 years in particular is how racism, structural racism, and its impact in criminal justice, and in how we police our communities, and educational outcomes, and access to COVID vaccines, all of that really are those core underlying factors that contribute directly to the lived experience of everyone, not even whether you're Black, Indigenous, or person of color. Those health outcomes that are tied back to structural forms of oppression really do dramatically impact all of us, because they shape the communities in which we live. They shape the costs of healthcare and healthcare delivery. They shape the sorts of resources that are available to us, the sorts of ways in which people can show up in community.